Hi, my name is Kim Kennedy, and I work with the Office for Citizens with Developmental Disabilities. Today I'm going to facilitate a training on the OCDD HCBS provider waiver documentation requirements. This training is for OCDD in-home service providers for our Children's Choice Supports Waiver, RO, and NOW waivers. It is not for any other services, just for OCDD in-home services for Children's Choice Supports Waiver, RO, and NOW. We always like to ensure our providers remember the purpose of our waivers. So the reason we have our waivers is to support individuals with disabilities in the community to have a life like you and I have, so that they can choose to live where they want to live. They can have relationships with individuals outside of their family and outside of their direct support professional staff. And they can live fully integrated lives that can engage in community life, including the opportunity to work in competitive integrated settings. So this is the purpose of the waivers. The OCDD vision is to support a society that promotes partnerships and relationships which empower people with developmental disabilities to live fully integrated and valued lives. And so that's what we try to achieve with these services. The objectives of the training today is to ensure that your agency understands documentation requirements for these in-home services. Documentation has always been required, and it's been required in our program manuals. We're providing a standard documentation note for these in-home services, which you'll need to use unless you're using an electronic note system. If you are using an electronic note system, all the elements of the notes that we are showing you today have to be captured on the electronic note. And when I say an electronic note system, I'm not talking about a fillable form. I'm talking about a system where someone actually has to log into the system and provide password information in order to prepare their notes. That's what we mean by an electronic note system. We're also going to talk a little bit about what the desired documentation content should look like. We're going to review what we call the single shift note and the multiple shift note. That's the abbreviated term I'll be using throughout this training. When I refer to just the progress note, that's both of those notes. And then when there's something specific about single shift or multiple shift, I'll identify that as well. So we sent out communication to providers first on January 13th to let you know that we were going to be issuing a standard note and have a monitoring process due to some audit results that we've been receiving. That the memo was sent out on the 13th, and then we actually distributed the documents with an informational bulletin on January 17th with instructions. These are posted in lasers on January 17th. Now, we've also posted these documents on our OCDD web page under the OCDD, under the web link that's listed here. So they're also posted on our web page. These notes, the standard note, you'll see them in a minute. We're going to pull them up. Well, let me do that right now. Let me pull up the single. Let's see which one. Single shift. Nope. Is that the single shift? Nope, that's the double shift. Let me pull up the single shift. Okay, here's the single shift note. Now, these are the notes that are posted on our OCDD website. They're also posted in lasers. You see that we have some blue highlight on there. That was just to help differentiate the different sections. The notes, when you print them out to use the forms, you do not have to print them out in color. And let me say this, we don't want you to change the format of the note. You need to use the note in the format that we provide. However, we are continually receiving feedback from providers on what we could do to improve the notes. So you may see some tweaks to these documents in the future. So let's get started. Me close this note. I do want to show you one other thing about the multi-page note, just real quickly. These notes are, well, that's the single. It's hard for me to tell which is which. This is the multi-page note. So you can see if it's multiple shifts, you're going to have 3 different people on one note. The information up here, you're going to use initials instead of X marks. These are the ADLs, and you're going to indicate when you assisted someone, and you'll enter the time when you assisted. And then these are the daily progress notes. So this is page 2 of the note. Whoever works shift 1 is going to have to fill out this information for whatever applied to their shift, and then complete the note for shift 1. Okay? If it's the single note, the individual will identify anything supported, any of these areas that were supported during their shift, and then they will provide a narrative down at the bottom where the progress notes are. So having seen that, let's continue on. There are exceptions to what services should be using this documentation. So first, let me tell you which services are required to use this documentation. It is for the Children's Choice, Family Support and Crisis Services. In the supports waiver, it's for the in-home respite. For residential options waiver, it's for community living supports. And for the new opportunities waiver, it's individual and family supports. So the thing that is the same on all of these services is they are in-home supports for provided in those waivers. There is a habilitation support provided in the supports waiver that is in the home, but this document is not to be used for that service. All habilitation and vocational services are going to be documented on the notes that are provided by our vocational program manager. And those documents have already been sent out. So if you don't have that document, you can email us at ocdd-hcbs@la.gov. But these are the services that are going to be used on this new standard note that we're issuing today. Training is not applicable to our this training today, and the documentation note is not applicable to the OCDD vocational provider agencies. That would be your DAHABs, your pre-vocational service providers, as well as your supported employment providers, and that habilitation provider in the supports waiver. So these forms are not for those services, and they are not for Office of Aging and Adult Services. You know, OAAS has their own note, their own standard form. You must use whatever OAAS requires for their waivers. This is strictly for OCDD. Saying that, it is also not for LTPCS or for EPSDT. Again, those services have their own notes, their own forms. These forms are only for the OCDD waivers. So let's talk a little bit about how we got here. CMS has always required services to be documented. And y'all know the old adage that if it's It's not documented. It didn't happen. That's the same with this. You can't have just a clock in and a clock out and some check marks to say that's documentation for what I did. Documentation requires some narrative of some sort. So no documentation means no services were provided. So if you bill for them, then you don't have the documentation to support your billing. It's also always been a requirement in our program manuals. So if services are not documented, like I said, they did not occur. So these agencies, the LLA, Louisiana Legislative Auditor, the LDH Program Integrity, and PERM, who is a CMS auditor for the periodic error rate measurement audits, have continually reported noncompliance with documentation requirements. We have seen this, especially with our LLA audits, every single year. The LLA has actually issued a finding 23 out of the last 24 years regarding inadequate documentation. So, because of that, OCDD was required to do a corrective action plan. And part of that corrective action plan is to develop a standard documentation note and to train providers on the content of that note, which is what we're doing today. Some of the issues that were found for the inadequate documentation were that there's no note at all for the date of service that was paid. There wasn't a note for the entire date. So some shifts, there was no note for some of the shifts that were billed. And overnight shifts were not properly documented, so it was hard to figure out if a note was for an overnight shift or not. And were the notes adequate to support the amount of time billed? The other area that we had that LLA identified was that providers did not have the current plan of care with provider attachments in their file. Now, in order for a provider to be able to provide services to an individual that meets the plan of care and addresses the goals and objectives of a plan of care, in order for that to happen, number one, the provider agency has to have the plan of care in their office. They have to have been able to read it and see what the goals and objectives are for that individual. And they should be training the direct service worker on that plan of care. So the direct service worker knows how to provide the supports. So if you do not have the current plan of care plus your provider attachments in your file, you need to reach out to your support coordinator and get those documents now and have them in your file, because that plan of care is going to tell you what the goals are for that individual. And that is what you should be providing services to support those goals. In our record keeping section of our OCDD program manuals, this is what's written. We expect the services to reflect, or the documentation to reflect a description of the activities, procedures, and incidents, give a picture of the service that was provided to the beneficiary, show progress towards their personal outcomes, record any change in their medical condition, behavior, or home situation, and reflect each entry in the service log or timesheet. So this information has to be provided for every shift that's worked, a description of the activities, procedures, and incidents, and a picture of the service provided to the individual. And services must be clearly related to the current plan of care. Again, if you don't have that current plan of care, then how do you know if the services being delivered are in support of that plan of care? If you do this, if this is the information that is provided, then there is increased confidence that the individual is being supported per the plan of care, they have the opportunity to achieve their life goals, and they're being monitored to identify any changes in their life situation. Service logs versus progress notes. So those are two different types of documents. Our program manuals require both, but we have combined these two into one note. So the service log is your chronological listing of contacts and services, reflects the services delivered, identifies who, when, where, and what was delivered to whom, and it identifies the personal outcomes and other issues addressed. The progress note takes that information and provides a description of those activities and a picture of the service provided. And as well, the progress towards their personal outcomes and any changes in medical, behavioral, or home situations. And it reflects every entry in the service log. So we've combined the two, so there's just one document that you have to fill out. And let me say this, the progress note that we've developed, that in addition to lasers, which has all of your in and out information on it and specific type of service, those together provide the service log and progress note combination. This is just another way to kind of look at it. The service log, again, like I said, is the who, when, where, and what were delivered. Was it day services? Was it night services? Was it shared services? And it's required for every shift work. And the progress note provides a description of those services. Now, our program manuals have always stated that checklists alone are not adequate. So both the service log and progress note elements are required for adequate documentation. What is your role in ensuring you have the proper documentation? Well, the first thing is ensure that documentation is prepared for every shift, excuse me, and is adequate and complete. So direct support workers should not leave the home without having completed the note for the shift that they have worked. The only way to ensure that documentation is adequate and complete is for the supervisor to review documentation. So a supervisory review of the direct service workers' documentation is expected. This helps ensure that the direct service professional is providing the support as outlined in the plan of care, helps ensure you're not billing for undocumented services, and that you're able to identify if a worker requires retraining. So make sure documentation is prepared. Do not bill for services if documentation is inadequate or missing. Retain documentation for a period of 6 years or as required by CMS, whichever is longer. Right now, our program manuals require you to retain documentation 6 years. So, and we will update our program manual if that requirement changes. And provide ongoing training and coaching to direct service professionals and supervisory staff. Now, supervisory staff have to be trained as well so that they know what it should be expected when they review documentation. You're also required to provide these documents to these agencies when requested. If you have an electronic note system, you're expected to be able to print out those notes and provide them to these agencies when requested. So, Louisiana Department of Health, CMS, the LLA, who we know looks at notes every year, local governing entities, support coordination agencies, and any subcontractors to the above. So let's look at single note versus multiple note. And I want to identify some basic guidelines first. I've talked about documenting a shift. So what is a shift? A shift is a continuous period from clock in to clock out. So if someone's working a shift, they clock in, they work the shift, and then they clock out, and they should have been providing services that entire period. A split shift is when a DSP clocks in and out for one shift, they leave the home and maybe go work with another participant or do something different, and then they go back that same day with the new clock in and clock out, sort of like a morning shift, afternoon shift. That's a split shift, and I'm going to tell you, each shift has to independently be documented. If you're providing shared supports, you want a separate note for each beneficiary. You cannot combine two beneficiaries on one note. Each beneficiary has their own file, and their notes have to be in their file. Can't have a combined note. And in the rare cases that you may be providing two-on-one support, each DSP has to complete a note independently for what they did. Now, two-on-one may happen when someone comes out of a hospital and you require two staff to help with bathing or transferring or something to that effect due to their condition. If that occurs, that has to be approved by state office. You already know if you have two people working with one person at the same time, it's going to be blocked in lasers as an overlap. So if there is two-on-one support, we have an override in our system, but only the state can authorize that. But each DSP has to write their own note. Let's talk a minute for what happened recently with the statewide or local emergency that we had, which was our snow days. 100-year snow, right? Well, we had a 100-year flood I guess about 8 years ago. And y'all know we have hurricanes, most hurricane seasons. If someone has to stay with an individual for more than 24 hours, for like 2 days, then they need to clock in and out every day. And one day is a shift. You can't have a shift that is Tuesday from 6 a.m. to Thursday at 10 p.m. You cannot have a shift that's 3 days or even 2 days. Each shift can be no more than 1 day because our notes are for 1 day. So each shift can only be for 1 day. In the event you have an issue like this, and the DSP should be clocking in and out every day. If you don't clock in and out every day, you clock in on Tuesday and you go to clock out on Thursday, well, the system's going to think you abandoned the clock in, so it's not going to work. So make sure you clock in and out every day. That's just a little extra for you to know. All right. We are not gonna mandate how you use the single shift note versus the multiple shift note. We'll make recommendations, but you can do it however you want to because we're just providing the standard form. We just wanted to have a form that you could use for a multiple shift note in the home of a beneficiary for a single day versus always having to use just the single shift note. Single shift note is for one direct service professional that works that works for one beneficiary for one shift. Now, the single shift note will allow you to document an overnight shift. That way you don't have to fill out 2 pieces of paper for one shift. But that only is allowed on the single shift note. So if you have someone that works overnight all the time, they work, 10 p.m. to 6 a.m. And we want the notes to be documented before they leave the home. Then they can prepare their note when they get there. And when they clock out the next morning, they can finish up their note. And when we look at the actual basic information, I'll kind of show you how that, I'll guide you on that, how that should look. For the multiple shift note, that's only for one date of service. So you can only have one date on that note. And it allows up to 3 DSPs to document on the same note. And this is good for people that have 24-hour care, that have multiple workers in the home. I understand that some people say 3 is not enough. 3 is all that we could get on the note. You can use a second multi-shift note if you need to do that for the rest of the day, but we only have room for 3 on the note. This note also allows a single direct support professional to document a split shift. So we talked about what that was for the same day on one note. And if you have a DSP that works a split shift, I strongly recommend that you use the multiple shift note so they only have one document to fill out, and you'll have it all there for that person. And you can kind of mix and match these as you need to. For instance, if you have a multiple shift, if you have someone that works overnight, has 3 or 4 workers, and the last worker works an overnight shift, well, maybe you'll want that last worker to use the single shift note instead of the multiple shift note because they can document their overnight service. So you can kind of mix and match the way that makes sense for your shifts that are being worked. We just do recommend that a split shift be on the multiple shift note. So everything for that worker, for that beneficiary, for that day is on one note. So these are the similarities between the two. Single shift note requires printed name and signature. Multiple shift note requires the same, but it also requires the initials of the direct support professional. The single shift note requires home or other to be checked in basic information section if in and out time is manually entered. I'll explain why that's important in a minute. And the multiple shift note requires home or other to be checked on page 2 if time is manually entered. Single shift note allows for check marks in the top 4 sections, which is your community engagement, the work, education, social roles, appointments, and challenges. It allows you to check off areas there. The multiple shift note, instead of check marks, you need to use initials because you have more than one person completing the record. The ADLs provide a space for you to describe the type of assistance provided, but we didn't have room on the multiple shift notes, so any assistance provided has to be documented in the progress notes section of the note. And both of them require the progress notes section to be completed, even if there were no community engagements, they didn't go to work or to school or anything like that. There were no appointments, no challenges. You still have to write something in the progress note to give us an idea of how the day looked. That progress note section is on page 1 of the single shift note. It's on page 2 of the multiple shift note. And there is no page 2 really for the single shift note, although we do have an additional progress notes sheet. If you needed more room, we do have a form that you could use. We'll look at that in just a minute. So let's talk EVV versus manual. When I say staff is the direct support professional who directly provides a service to the beneficiary. So that's the worker, right? EVV, electronic visit verification, means that the staff clocks in and out using an electronic method. So they're clocking in and out through lasers or through a third-party EVV. There are some companies that have a third-party EVV, but they're using some sort of electronic method. So that direct service worker is actually clocking in and out on a device. That's EVV. Only staff, only the direct service professional can clock in and out for themselves, no exceptions. I think at one point, some companies had staff calling them when they got to the home, and then the supervisor would clock the person in. That's not allowed. The supervisor can do a manual entry, but they cannot use the staff person's login to clock them in. Only the DSP themselves can clock in for themselves. Manual entry is not EVV, just so there's no question. And if the EVV entry is modified after the fact, documentation of the change is required. Remember, EVV is like a timesheet. It's that person clocking in and out for work. So if it's modified, and it can only be modified by a supervisor or someone in the office, then there's got to be documentation of the change and why the change was made. Let's talk a little bit more about EVV versus manual. And the reason this is important is when we actually look at the basic identifying information, you'll understand what I'm talking about. If EVV is used for in and out, there's a spot on the progress note for you to put your time in and time out. If they use EVV, they can write EVV in those in and out blanks because the EVV is going to be captured in lasers, right? Lasers is going to capture or that time in and time out as an electronic clock in and clock out. So they can use EVV if they electronically clocked in and out. However, if they can write their time in instead of writing EVV, but they just have to make sure that the time they're writing in exactly matches the EVV clock in and clock out time. We just don't want there to be a discrepancy between the EVV clock in and out and whatever is written on that progress note. If EVV is not used, they have to record the exact time in and out with an AM PM designation. So they have to write their time on the progress note. Some companies still use military time based on the way we started this many years ago. If you want to use military time, that's fine because that's exact time in and out. You just don't have to use AM and PM. So military time is fine. EVV also collects location of service delivery, and location of service delivery, where a service is delivered, is required by CMS. So we have to report that back to CMS. So EVV collects that information when you use it, but a manual entry does not. When someone goes in and just types in a manual entry, we don't know where that service was actually provided. So a manual entry, if a person writes their time in and out on the progress note, they have to identify where the service was provided. Was it provided at home or somewhere else, home or other? And the easiest way to think about this is where was the majority of the service provided? And then that's the one you pick. There's no real right or wrong answer. We just have to identify it. And again, if the EVV entry is modified after the fact, then documentation of the change is required. So let's look at that basic identifying information. And this is the information that's going to be collected there. So these are the two areas. The top one is single shift. Bottom one is multiple shift. Agency name and phone number, that can be typed in before you make copies if you want to. Even beneficiary name if you're going to put notes in a specific home. But the rest of the information has to be written in by the staff that's providing the service. Now, when you look at the top one, and this is the one that has the overnight shift, date of service, you're going to have two dates of service for an overnight shift because you're going to have the date the shift started and the date the shift ended. So if the shift started on January 31st, 2025, you would write that here at the top of that date of service line. And then just underneath it, you'll write the date that the service ended, which would be February 1st, 2025. And you would check yes, overnight shift. So this allows the person that worked 10 p.m. to 6 a.m. to show their overnight shift without having to fill out two pieces of information. If they're working more than just the overnight shift, I recommend that they use that they don't use the overnight shift designation. They fill out a new service log for the next day starting at midnight. That's how you would do it. You would start the next shift at midnight the next day, and if you worked like 10 a.m. So you're going to be there from midnight to 6 and then 6 to 10 a.m. I would use a new service log for that and not the overnight shift. The overnight shift really is just to help those individuals that all they work is like a 10p to 6a. That's really what the overnight shift is for. Otherwise, you should start a new note for the next day. The multiple shift note is the same way. There is no overnight, of course, for multiple shift note, and you realize there's only just one date of service, but you have multiple staff. And this is where you have to put in your initials. Now, this home or other on the top example, this is where you would check if you had to write your time in and your time out because you did not use EVV, then you would have to check either home or other. Again, it's the majority of where that time was spent. But if it's the multi-note, then that home or other is on page 2 of the note where you write your narrative. You'll have a place to check home or other. So let's get into some examples and some of the sections so you can have an idea of what to look for. So we're going to talk first about relationship support and community connections. Remember, one of the things we want to do is make sure individuals are integrated into the community, they have relationships with family and friends, and they're able to participate in events. We're going to want to know what it was that they attended, how did they attend, how did they participate, and then we're going to need to know the specifics of what they did. So let me give you an example. So the top piece is where you're going to put your check marks. And again, if it's a multi-shift log, you're going to put initials. So this individual, yes, they had some relationship support building and community connections activities on their shift. And they participated independently, and they had assistance provided by staff. So if you read the narrative, now this goes in the narrative section, the description, Nancy was in a good mood when I arrived because she's going to a family reunion in Clinton for the first time in 3 years. Now that first time in 3 years may be significant. Maybe she has a goal to be more involved with her family because she's been estranged. So that's why it's good to say, to give some specifics. As we told who she's going with, her sister Sarah. The worker drove her to Sarah's house, and on the way they stopped at Walmart to pick up cookies for the reunion. They arrived at Sarah's around noon. Sarah will provide support the rest of the day, and the worker clocked out when she left Sarah's house. So it gives you a picture that this worker probably only provided supports up till noon or a little bit after that because she had taken she had taken Nancy to her sister's house. So this gives you a really good picture of this activity. And again, the narrative is in the progress notes section. If there's anything else going on, for instance, if this is a goal for her for the first time in 3 years to be with her family, then that's captured in the progress notes. And I'll talk a little bit more about one of the ADLs that we would also write in here if it was a goal for Sarah. I'll explain that when we get to the ADL section. This is an example that's not very good. Staff dropped Nancy off at sister's house around noon for family reunion. You know, that just doesn't give you, I mean, it's true, shows what she did, but there's a lot more information that could have been provided to kind of give a picture of the day, a picture of the services delivered. Education, work, and social roles. Now, I've given you some ideas of what we mean by education, work activities, and social role activities. These are not written in stone. This is just to sort of give you a guide as to what we're talking about when we talk about these things. So education, of course, schools, universities, taking GED classes for future employment, but education could also be someone taking a pottery class, if that's something they wanted to learn, or a quilting class, because it does teach them something. So you could also use education for that. We're not going to be real sticklers for that type of thing. Work activities, same thing. Could be applying for a job, going on an interview, attending a job fair, or maybe she's going to pottery classes to open her own self-employment um, uh, business. So that could have gone in work activities. Like I said, we're not going to be real sticklers about where you identify it. Social roles or when an individual is a member of an organization, DD Council, church choir, Rotary Club, other community organizations, and they go to an event with that organization or a meeting. That's what the social role activities are for. So what we need you to do is to tell us what type of assistance was provided. How'd they get to the location? Did they need assistance applying for anything? What kind of support was provided to participate? Did they participate with assistance from another provider? Or did they participate independently or with assistance from a family or friend? Now, let me say this, and this is true for the community activities as well. The worker is only required to document the activities that occurred while on shift. But as you could see with Nancy in the previous example, the worker knew she was going to a family reunion. She didn't go with her to the family reunion. She doesn't know what all happened there, and that's fine. So she can't document that. But she knew it was happening, so she could document what she knew. And you would document the specifics in the progress section note of the progress section of the note. The progress note section of the note. If you're using the multiple shift for single date of service, and I'll say this every time, you have to use initials, not X marks. Let's look at an example. All right. I drove John to NTCC to enroll in GED classes. I helped him fill out the application. He will attend on Tuesdays and Thursdays from 3 p.m. to 5 p.m. He has a goal to get his GED. Now, so I provided assistance getting there, assistance with applying, and that's it as far as the X marks, the X is above. So this is a good example of some detail. And look, it's not nearly as long as the other one. And you don't have to use as many words as I did. I'm just trying to give you a good picture of the type of information that should be in the note so that a picture is provided of what was of the support provided. Here's another one. Here's a poor example. I took John to apply for GED classes. And that is, they did it. That's one of the activities they did, but there is more detail or depth that could have been provided. Health and medical appointments. Now, I'm going to say here, starting with health and medical, and when we get to challenges, we talk about you only need to document what happened during your shift. However, for health and medical appointments and challenges, if you become aware of an appointment that a worker went to while you were off shift, please write that in your notes. Write as much information as you have about it because it does affect their health. So, identify the type of appointment, a doctor visit, and it could be a dental visit, any type of doctor. Lab tests, scheduled procedure, behavioral health visit, physical therapy or any kind of therapy in home health coming into the home. You can identify any of that. And if there were any instructions provided, so were there any additional instructions that the medical provider, MD, even a dentist, whoever provided, and is there any follow-up needed? And if you're using the multiple shift for single date of service, you use initials. But like I said, if you know something occurred during this shift, or something occurred and it wasn't during your shift, you get to work, the mom says, oh, we took Janie to Dr. John this morning to just for a checkup, everything was good, then you can report that in your notes as something that her mother relayed to you, and it would have been assistance. Sorry. It would have been assistance. You would just put in here who took her to the doctor. So here, Janie had a doctor appointment. I listed the doctor's name. I said why she had an appointment, what he did. He drew blood. She has a low iron level. He put her on vitamins with 25 milligrams of iron once a day. So the worker picked up the vitamins at the Walgreens. She has a follow-up appointment on 4/25/25. The doctor visit summary is in the binder, and I contacted the supervisor to update the medication list. Now, if she didn't know when the follow-up appointment was, if mom's going to make a follow-up appointment, then she should say Janie's mom will make a follow-up appointment. Anything like that. Just if you don't know, provide the information that you do know, I guess, is the best way to do this. And then this is a poor example. Janie had an appointment with her PCP today and he put her on vitamins. She has to go back in a few months. Well, if they had all the detail in the prior note, that's really what we want to see. This really gives you a better picture of what happened that day versus this. Let's talk about challenges. And again, if there's a challenge that occurs and you get to work and you find out about it, you do want to document it in your progress notes just so your, oops, sorry about that, your office is aware of it. Here we go. So identify the challenges. This would be like a medical symptom, a critical incident. Were they sick? Was there a behavioral incident? Was there a medication error or problem? These are things that happen that are not expected to happen necessarily. Was a plan followed and documented? Was a supervisor contacted? And you need to give the specifics of this in the progress notes section. And again, use initials if you're marking off any of the boxes on the multiple shift for single date of service. So let's look at an example. So here's one where Dan missed his GERD medication in the morning. So we say when he missed it, what was the outcome of missing his meds? He said his chest hurt and he felt like he was going to throw up. He threw food at me during lunch because he did not want to eat. And so I notified the provider nurse who came and did an assessment, and the nurse contacted the doctor to get instructions on adjusting meds for the rest of the day. But that could have as easily been that a supervisor called the doctor to get information on what to do, or the direct service worker may have called the doctor on what they needed to do. So, but this information should always be reported to your supervisor. And if you contacted anyone specifically regarding this, you need to identify who that was. So in this case, they contacted the provider nurse, Susan Ford, listed the name, and she did some follow-up. This would be a poor example. Dan felt bad today. He had a behavior problem because he felt bad. He did not eat much today. That sort of describes what happened, but it doesn't really give you the depth of the other incident description. So that's why it's important. Now, I will say this. Someone may ask, well, if he missed his med, why didn't you write a critical incident? Well, you only have to write a critical incident if the missed medication results in him going to the hospital, the emergency room, or an urgent care clinic. So if it resulted in that, then you would also have a critical incident checked off, and you would write up any documentation for critical incident. Other things that you could use this for is someone that perhaps has a seizure protocol. Someone had a seizure today. Okay, well, did you follow the seizure protocol? Did you do any documentation per the seizure protocol? Was a seizure log completed? That would all be identified in the progress notes section. Or if someone is on a behavior plan and they have a behavior incident, what interventions were required for the behavior incident? And was there anything, did you have to document it on any specific type of form for that person? Or did you just document what you did in the progress notes? And that would be fine too. Again, this was one that's not so good. And so let's do ADLs, IADLs. You want to provide a description of the assistance provided. If it's independent, indicate that. Or if someone else did it while you were on shift, indicate who provided assistance while you were on shift. You know, who was the person and what level of assistance. But if it's independent, you can just put independent because you didn't have to provide any assistance. If it did not occur while the DSP was on shift, write NA. That tells us, hey, this didn't happen while I was on shift. If additional details are required, write that in the progress notes section of the form. And if you're using the multiple shifts for single date of service, you're going to record the time of the assistance that you provided on the ADLs, and then write the details in the progress notes section on page 2. So we're going to go back and look at Nancy's ADLs. Now, Nancy fixed her own breakfast, eggs and toast, for eating. Well, guess what? Nancy has a goal to start making small meals. And so that's really achieving a goal. So I would identify additional information in that progress note that says Nancy prepared breakfast independently. Our next meal may be, we will try preparing lunch, whatever the next step would be. But this, if it is something that they've done independently and it's a goal, you need to describe that in the progress notes. If they're just independent, like here, Nancy is independent with toileting, she has no goals for toileting, then just, you could put completed independently or independent, that would be fine. But if there's a goal associated with that independence, then you have to write something in the progress notes. So here, Nancy fixed her own breakfast. I helped guide selection of clothes for the family reunion. She independently washed her face, brushed her teeth and hair. Maybe that was the first time she did it without prompting because she was so excited about going to the family reunion. Well, I would indicate that in the progress notes. Here she completed toileting independently because it did occur while I was on shift. She didn't do any bathing. There was no transferring or lifting. Shopping. Remember, they picked up cookies on the way to Sarah's house. So they did stop and buy cookies. And Nancy also independently cleaned her kitchen after breakfast. That may have been a goal as well. And if it was, see, I could put just independent there if that's something she always does. But if it's something that is also a goal, then I may give them a little more description there and then just identify in progress notes that it's a goal, that she worked on this goal today. Managing finances, review checkbook with Nancy for shopping later. Managing time or scheduling, I had to prompt her to stay on schedule to go to her brother or sister's house. And medication, I prompted her to take her morning meds. But if she's independent, meaning I didn't even have to tell her, you could write independent there if that's something that's documented in her plan of care. But if she's not independent, if you're supposed to prompt her and she took it independently, then note that in the progress notes because that shows that she did something independently that normally you have to prompt her to do. And if you administered meds, say administered morning meds or administered evening meds, and fill out whatever documentation is required when you do that. Here's a poor example. Same situation, but, it wasn't, who made the breakfast. It indicates what she ate for breakfast, and that's the only meal they were there. but doesn't tell you that she independently prepared it, doesn't mention things that did happen, didn't mention anything that she did independently. So this is not a good example. You want to put as much information as you can here in those spaces. And if it didn't occur, always put your NA. Let's talk just for a second about what someone eats every day. So if someone is on a specific diet, because they're diabetic or they have high cholesterol or there's some medical condition that puts them on a specific diet, then you should be identifying what they're eating in the notes because it's important to kind of track if they're staying on their diet, especially if they start feeling bad or start getting sick. You have a new worker goes in and they give them something they shouldn't give them. You want to document the food in the notes so that when the supervisor reviews the notes, they're aware. Last section, progress notes and descriptions and comments. The progress note, or what we call the narrative section, is required for every note, on every note for every shift. So when you use that multi-shift note, anyone that's identified on that note should have a note written for their shift. And if it's a split shift, there should be two notes, one note for the morning shift, one note for the afternoon shift, even if it's the same person. So a note for every shift. If any of those top sections have checks or initials in them, so that would be the community engagement, the social roles, education and work, appointments and challenges, if anything's identified in those sections, we would expect additional information to also be in the progress notes and descriptions. Also, this section will contain any information about work support provided towards goals and objectives in the plan of care. Sometimes a goal may not be identified in any of those other sections, but you worked on it, so you want to be able to report on that in the progress notes section. If you're using the multiple shifts for a single date of service, remember that progress note is on page 2 and it's identified by shift. So let's look at a couple of things. So here's a couple of examples of good notes. Now the top one is a goal that Leonard has to find housing. Maybe he's wanting to move. He doesn't like where he's living or whatever the case may be, but he's looking for housing and it's a goal in his plan of care. So here's information about putting in application for housing. And it just says, how she took her to, the worker took him to 2 apartment complexes, assisted with the applications, also made a note that he's already saved his money for the deposit and getting utilities turned on, identified where they went to apply for opportunities, and even gave a reason why they went to those 2 apartments because he works at Rouse's on Florida, and they want him to be close. Also, that they're now waiting on them to contact Leonard. So that gives a good description of a goal that is in his plan of care that's being worked that would not have been listed in any of the other sections. The bottom one is a little different. So this is for a date where you have someone that works just an overnight shift, or you have someone that works a day shift, and maybe it's an 8-hour shift or so, but they don't do a whole lot. There's not a lot of activity on that shift. So for an overnight shift, I checked on John every hour throughout the night. He got up once to go to the bathroom. John slept good tonight. So the fact that he went to the bathroom, there should be something on the ADLs for that, and maybe NA for all the others. But it shows that the worker was engaged and monitoring that person while he slept. So for a day shift, you could say something like, John stayed in today and watched Law and Order in Chicago PD most of the day. He had cereal for breakfast, a sandwich for lunch, and pizza for dinner. We did laundry since we stayed in. The day was quiet. Kind of gives you an idea that it was just kind of a slow day. You watched TV a lot, y'all did laundry. There were 3 meals prepared. Now, on the ADL section, it should say, did staff prepare breakfast, lunch, and dinner? That would be on the ADL section. So you would expect something to be written in the ADLs and any other ADLs that may have been assisted with that day. But this is for a shift that where you stayed in most of the day and not a lot happened. No phone calls from family, nothing like that. I would hope this is not the typical day for an individual most of the time. I would hope that there would be more community engagement for him getting out and being more involved in the community. But there will be days like this. So, and like if it had been a snow day, you might want to put in there what y'all did in the snow. Just an idea, sort of a picture of the day. These are poor examples for all 3 of those. The first one is drove Leonard to 2 apartment complexes to put in an application. I assisted with the application. That's not very much detail, especially in the previous note where I could tell you where he went and why he went there. Or John had a good night, or John had a good day. That's just not enough information. And this is that extra note that can be used for the single or multiple shifts, but it's for one beneficiary for one date of service. But you can have multiple, if you have the multi-shift note, you can have multiple people write additional notes here. Wouldn't be the primary note because the primary note is on page 2. This is an extra page if page 2 wasn't enough. They could write additional information here, or for the single shift, if they didn't have enough information at the bottom of the note, they could write it on this. So let's kind of wrap up. First, I just want to remind you why we did this. It's because of the audit findings we've had with the LLA. We were required to issue a corrective action plan, and part of that resulted in us coming up with standard documentation in this training. We want providers to start using that standard note by February 15th, 2025. I get it. This is today, the day I'm recording this is actually February 3rd, not much time. So we want you to implement it as soon as possible. Any electronic notes have to contain the same elements as a standard note. We're going to start monitoring notes the beginning of fiscal year 2026, which is July 2025. So we're going to start, OCDD is going to go out and monitor providers to see and to review the quality of the notes and see what they're using to document their notes. This is not a gotcha. This is to help you get better. We have to get better. We've had too many audit findings, so we're implementing this. We're going to monitor and provide feedback to you, and then we need you to take that feedback, train your staff, and improve the documentation that your DSPs are preparing. We're going to monitor all providers. So everybody's going to be monitored, even those that have electronic notes. So we're going to be looking at those as well. And if you have any questions or comments, you can send them to ocdd-hcbs@la.gov. Just a reminder, we are open to feedback. We did get a lot of questions during our trainings, and we are putting together a Q&A to be posted, but we wanted to get this training out first so providers could use it to train their staff. As always, we appreciate all that you all do to support the people that in our waivers. Y'all are very, very important to us, and we do appreciate all that you do. So with that, I'm gonna say thank you, and we appreciate appreciate all you do. Y'all have a good day.